Assalamualaikum and good morning. Today I will be presenting on my thesis with the title Image Quality and Radiation Dose in Intravenous and Integrated Intravenous-Oral Contrast Enhanced CT Abdomen for the Evaluation of Appendicitis with the conjunction of 13th International Symposium of Health Sciences. So my name is NURHAMIZAH binti HOSNI as a presenter, and along with my supervisor, Mr. Muhammad Hafizi Mahmud from Universiti Teknologi Mara. For the introduction, we have background of study, problem statement, significance of study, and also objectives of the study. First of all, a little bit about acute appendicitis is an abdominal condition that may require surgery and classified as a medical emergency, which can increase the mortality due to septic shock, peritonitis, and injury to the intra-abdominal organs if treatment is delayed. So basically, administering both oral and intravenous contrast can diagnose the acute appendicitis, which the most extensively used as a CT protocol of abdomen. The problem statement that stated in the study is to describe one successful approach to contrast protocol of CT abdomen for appendicitis. This study is significant as the current management of patients with suspected acute appendicitis may improve, especially in the time management. So if the findings show that different result in comparison between both contrast protocol, by reason of delayed diagnosis can lead to mortality and morbidity in sepsis. The general objective in the study is to measure the image quality as well as radiation dose in intravenous and integrated intravenous-oral contrast enhanced CT for the evaluation of appendicitis. But the specific objectives is to compare contrast noise ratio, signal noise ratio, and image noise between intravenous and intravenous-oral contrast or CT protocol in detecting appendicitis. Number 2 is to compare dose length product and the effective dose between both contrast protocol in CT abdomen. Next, we move to the second chapter of the study, which is the literature review. CT technique in diagnosing acute appendicitis is mostly by administer oral and intravenous contrast for the patient, but some approach are also possible without having oral or intravenous contrast material. Intravenous contrast also make it easier in assessing the abdomen for further pathology, according to Anderson in 2022. Image quality of appendicitis. So the fundamental components of the image quality in CT, which are the image contrast, spatial resolution, and image noise, as stated in Goldman, LW 2007. So this factor interact to influence the sensitivity and also visibility of details image. Next, an average radiation dose exposure received by a patient during a CT abdomen for appendicitis examination was estimated at approximately 8 to 10 millisievert per study. In this chapter, we have the methodology of the study. In research design, a retrospective study was used in collecting data of patient details from the CT PACK system of Hospital Tanah Bayar, Kedah. Next is the sample population. So there are 74 sample size we used in this study. The materials used are the data collection of CT abdomen axial images through PACK system of Radiology Department in Hospital Tanah Bayar, Kedah. So there are 5 methods, which are the image acquisition. Next, we have image manipulation, and then image evaluation, followed by data analysis as well as report writing. Chapter 4 in the study showing that the results and discussion, which are independent t-test and also the discussion of it. In independent t-test, the results show that the statistical analysis of independent t-test with p-value less than 0.05 was deemed statistically significant. So no significant changes were observed in contrast noise, signal noise, and image noise of intravenous and intravenous-oral contrast-enhanced images, respectively. However, dose length product and effective dose were significantly changed in intravenous and intravenous-oral protocol. So, from the results, there is a significant increase of the image quality parameter for the CT appendicitis using an intravenous oral compared to intravenous protocol only, reported by a study in left cohort in 2021. Also, in the past study, many have discussed that the relationship between the radiation dose with contrast media, concern about the potential cancer from the diagnostic irradiation of abdomen has been raised due to the rise in the use of CT for diagnosing appendicitis. So the last chapter is the conclusion. In a conclusion, the diagnostic of image quality has shown that almost equal in assessing the acute appendicitis from two contrast administration protocols, which are intravenous contrast and intravenous oral contrast. Meanwhile, comparing the radiation dose for abdomen CT for acute appendicitis alone show that there is slightly different radiation exposure for both intravenous and intravenous contrast protocol. Thus, the main objective was achieved. That's all from me. Thank you.